Hello everybody, Bruce McGonigal here. So Mark Carney just told us that healthcare in Canada is a right. Listen.
In America, healthcare is a big business. In Canada, it is a right. Thank you.
Okay, folks, so there it is. So if it's a right to have healthcare in Canada, and our system is so great compared to America, who do British Columbians get to sue because our emergency rooms are not staying open? Who do British Columbians get to sue because our rights are being infringed when we can't find a family doctor? Who do we sue when our rights are being infringed because we can't get a specialist or there is no cancer treatment available in Canada and people have to go to the United States of America to their for-profit system to actually get life-saving healthcare? Saying that healthcare is a right means absolutely nothing, and even less than nothing. It's technically a huge slap in the face to the 4,000 plus people who died in British Columbia last year alone waiting for healthcare. This is a problem that's grown exponentially. More people are dying waiting for healthcare in British Columbia than died from overdose or died from medically assisted dying. So people are choosing MAID to die because they can't get healthcare. And even more people on top of that are dying, clinging to the hope that they will get life-saving healthcare, but unfortunately they do not in our system where healthcare is a right. We all need to hold Mark Carney and everybody else accountable for this. It is not a right to have healthcare in British Columbia. It is a privilege, and the privilege is decided by the NDP, and the NDP in here in BC passed Bill 36 to make it illegal for your doctor to actually give you their medical opinion. They could end up in jail for 2 years if that opinion disagrees with official government narrative. So the government has taken over not only deciding if you get health care, the government's taken over what your doctor can even tell you as part of your health care. Isn't that wonderful, folks? So that's the right that you have, is to have your doctor tell you what the government thinks is best for you. And the government wants to link all of this into AI, so it's not even your doctor anymore telling you. Like if you call up and telehealth in BC, these folks are just reading you what's in Google. I'm not kidding you, I've done it. I have a sty in my eye that I've had to deal with now since the beginning of January. I have slowly taken care of it myself. I've had to go down to the pharmacy. They gave me some drops. Over a month of the drops, and it's still not gone. I finally got into an urgent care center where they took a look at it and told me there's nothing that really to do, and just maybe it'll take a month or maybe a couple more months for it to fully go away. That's our healthcare system out here, folks. I'm still dealing with injuries from a car accident in 2006 that have left me with chronic problems. And I don't even have a GP, folks. So can you imagine the poor folks that are senior citizens that are 60 or 70 or 80 years old? They have multiple underlying conditions that are deteriorating over time. Those people don't stand a chance at all. They don't have a right to health care. They have a right to MAID access. And then they can wait for health care and hope they get it before they die. That's the brutal truth in Canada. We need to start talking this way chronically upcoming to this election that's going to be happening in Canada. We need to make sure that people understand the stakes that are at place here, folks. We don't have to yell and scream. We just need to make sure that people understand that what we are being told is the exact opposite of reality. In British Columbia, the emergency rooms close. So nobody has access to those emergency rooms in those regions, and they can potentially have to go for an hour and a half to 2 hours somewhere else in whiteout conditions or in hazardous conditions or stuck where there's a one-lane highway in each direction and there's a terrible car accident, and now they can't get to a hospital. That's the situation that we're at in British Columbia here. In America, they keep their emergency rooms open. In America, they actually have plans that are available for people who cannot afford health care. In British Columbia, everybody can afford health care, but they just can't get health care. That's what we're being told, folks. And it's complete gaslighting. Mark Carney needs to be called out for it. Take care, everybody. I hope you had a great weekend.